I'm Dr. Roderick Santa Maria. I'm an internal medicine doctor, board certified in internal medicine. I practice in Boca Raton, Florida. I originally was born and raised in Buffalo, New York. I graduated from medical school at New York University. I did my internship and residency at Case Western Reserve Hospital in Cleveland. I then came down to Florida to establish my practice. And I've been in this area ever since, practicing at Boca Raton. Internal medicine has numerous subgroups such as cardiology, pulmonary medicine, rheumatology, infectious disease, gastroenterology. The general internist has to have a strong familiarity and background in all those areas so that you can treat the whole patient. You can see what the patient is complaining about. You can look at their exam, their lab tests, their background, their lifestyle, and try to treat all of those areas. Occasionally you have to use subspecialists. You have to refer to a cardiologist for a specific test or medication, but someone has to unify the whole approach and treat the person. They have to have a medical home, so to speak, where all their data is concentrated and various treatments that have been applied or tried are coordinated. That's really what a good internist does. And that's really part of the art of medicine. The art of medicine is, listening to the patient, seeing what works, and then, applying that feedback and to help them get better. So you have to listen, you have to be aware of technology, and you have to bring the two together. Unfortunately, as I've seen over my career, the pressures, economic and patient load on all doctors are just becoming so enormous that there's not enough time to spend to find out what the patient is truly feeling, how they're, the therapies that you recommended for them are working, and then to apply that updated knowledge and make it better. So it's the encounters are too superficial and quick, and it's very hard to go in depth, analyze, and apply that information. But that's what's needed so much, and particularly in chronic disease management. For instance, with the patients who have POTS or chronic fatigue, or the patients who have heart failure or diabetes, you really need to not just apply a one-size-fits-all approach and send them out the door. You need to really find out if what you're recommending is working, and if not, try the next thing and use that knowledge to help them feel and function better on an everyday basis. First off, there are many, many, many chronic illnesses. Each person is consumed with their own chronic illness, but each doctor has to deal with every chronic illness. So every patient that comes through the door has their own needs and history. So to focus on each of those conditions is very, very time consuming and tedious. But it's the only way to really help the person get better. And many of those patients have been to numerous doctors sometimes in various parts of the country or the world, and gotten numerous opinions, sometimes some of which conflict with each other. And it's hard to get a unified, ongoing treatment plan. If you're going to see different doctors in different locales or different specialties, you're not really going to have a plan of how you're going to approach your chronic condition. So most of these patients are left to their own devices to fill in the gaps and figure out what am I going to eat? What am I going to take? Does this medicine conflict with something else they gave me? Or, was this good for me at that stage of my illness, but now that I've progressed to another stage, it doesn't work? And someone has to be there to know what I call the horizontal history, your history as you go on through time, rather than just a vertical or incidental encounter where they see you once or for a day or for a week and then they never see you again. That doesn't make for good, unified, ongoing care. what's the normal human lifespan? Should be 110 to 120 years. So I look at it, if a person dies before that, something has gone wrong, something is defective, or maybe they smoked, maybe they drank, maybe they never exercised, maybe they have bad genes and that's just something they had to deal with. Or unfortunately, maybe they were born with a medical condition that progresses over time, so that it's familial or genetic. Whatever it is, we try to optimize. I feel like everybody has a range of optimal. Regardless of their condition, they can be at the best end of that range or at the worst end of that range. So I try to find out what their situation is and get them to the best end of their functional range. That keep them healthy, active, functional as long as possible.